Okay. All right, today we're going to talk about dialectic behavior therapy, and usually our didactics have something in common with the case that's being presented, but today it probably will have no connection. However, the previous 4 cases that we had talked about, this could be a useful tool, treatment tool to be used. So we're going to talk about what is DBT. I'll skim over a little bit of research about it, what is the treatment, and then some resources that you can get. Well, back in the 90s, Marshall Linehan combined CBT and mindfulness in adult treatment of borderline personality disorder. And more recently, in around 2010, Miller started using it with adolescents. Well, what does dialectic mean? It means dealing with 2 things that may seem contradictory. It's acceptance of feelings, which is mindfulness, and learning to change feelings. Mindfulness is focusing on the present, accepting of the individual in the moment. Acceptance is really necessary for change. Mindfulness practice and acceptance become a distinguishing characteristic of DBT. Let me give you an example. A youth is angry at her parents for putting her in a residential treatment center, but says they are doing some good things now. A therapist would take that and say, this is a dialectic, isn't it? It sounds like you're angry at them for putting you in a residential treatment center, and I appreciate the good things they're doing for me recently. Both feelings make a lot of sense. One can feel more powerful than the other, but both are real and there. And the therapist that gave that as an example said it really calmed the adolescent down because she was able to see both sides of the things. Well, DBT treats extreme emotional instability, dysregulation, and we talked about that actually in January. We did talk about that. And this leads to impulsive, self-destructive, or self-harming behavior. The goal is to teach the teens techniques to understand their emotion without judgment. That's the mindfulness part. And also to give them skills and techniques to manage these emotions. They're using balanced thinking, trying to avoid all or none. Some example of some dialectics that are used. There's acceptance and hope, independence and assistance, choices and limits, firmness and gentleness. And one of the key dialectic is validation and change. DBT has been used in adolescents with borderline personality traits, substance abuse disorders, eating disorders, major depression, bipolar, anxiety, ADHD, and disruptive behaviors. However, there's not a ton of research yet done on this with teens. Because it was working so well with adults, they thought, let's try it with teens and youth. And so there's been a lot of case study types of research or reports, but we're just starting to get into the random controlled studies. And so I'll let you read that when at your own leisure. There was another one that I found in 2014 in Europe that was a random controlled study that showed that DBT was more effective in decreasing self-harming behavior. And there's really a real big random controlled study going on in the US looking at the effectiveness in reducing suicide attempts. There's some reports around it decreasing the binge eating and being helpful in depression. So how do you do this? Well, what they have now is a treatment manual that I'll show you at the end. It's called DBTA for adolescent, and it's a manualized treatment of 16 to maybe 20 sessions, maybe a little bit more, it depends on the group that you have. And it consists of individual therapy, group skills training for the youth and parents. There's telephone consultation when there's an urge to self-harm. There's family therapy, and then weekly consultation sessions among the professional team members. So what are the components of this treatment? Well, the first one is teaching mindfulness skills. And the youth is to look at their state of mind, and there are 3 states of mind: the reasonable mind, emotional mind, and the wise mind. Okay, so what are those? The reasonable mind is what we all are doing right now, is that we're planning, evaluating logically, thinking things through. And this is really easy to do when you're feeling good. But if you're like most of our teens, they're not feeling good. So they don't use the reasonable mind a whole lot. They use the emotional mind, and that's when thinking and behavior is controlled primarily by emotion. Logical thinking is really difficult, and facts may be distorted to fit with the affect. What we try to do is get them to what we call the wise mind. This is the mind that can't be controlled by intellect or emotions, but they come together. It's more intuitive. It feels like the truth. You see the whole picture clearly, and you feel at peace with the decision that you've made. You really feel quite centered. And there isn't any black and white kind of thinking with that. So the next area that we look at is the treatment of emotional regulation skills in the treatment. And one of the things to remember is the goal is to reduce the suffering, not to eliminate it. That's pretty impossible to do. But again, teenagers will want everything gone. And so you have to really explain to them, we're trying to reduce it. And these skills teach the youth how to care for themselves when about what they want or what they need. And we teach them radical acceptance in this area. What is radical acceptance? You allow the world to be what it is. You agree to participate in the world, and you play the hand that you're dealt. And the teen learns a lot of different techniques. There are breathing skills that help them to relax and to help them be the person that they are and to accept themselves. There's something called a half smiling exercise where you relax your face, your neck, your shoulders, and muscles in a half smile, and other kind of awareness exercises where it helps them to accept and be aware of simple things in life that you can enjoy. The next area is the distress tolerance skills. And so one of the first key things you really want them to learn is how to survive a crisis, and that's because they have plenty of them in this group. So the first thing is to help them learn how to distract themselves from what's going on, how to learn all kinds of different self-soothing techniques. And then to use something that they use the acronym called IMPROVE. IMPROVE is for imagery, M is for having some meaning in your life, P is for prayer, opening oneself up to the moment, know why me, why did this have to happen, R is for relaxing, O is for one thing in the moment, V is for vacation, retreat into oneself for a brief period of time, and E is for encouragement, to cheerlead oneself through crisis as if you're helping somebody else. And then to accept life in the moment skills. Another things that they work on in the distress tolerance skills is how to change your emotions by acting the opposite. You evaluate the emotion and the events, and you teach replacement behaviors, and do things that are the opposite, like walk away rather than abuse somebody, watch a funny movie when you're feeling sad, do something active when you want to do nothing, and approach something when you're afraid of it. You also want to work on reducing emotional vulnerability. And again, they're really big on acronyms in this treatment program. So A is for accumulate positive emotions, B is build mastery, C is cope ahead of time of the emotional situations, and then please, which is treat any physical illnesses you have balanced eating, avoid mood-altering drugs, have balanced sleep, and get exercise. Probably that please is probably the hardest thing to get adolescents to do, or any youth. And then the next area is learning how to understand interpersonal effectiveness skills and how to understand communication styles, how to communicate assertively, be clear about what you want, listen mindfully, validate others, act according to your values, don't over-apologize, and find balance in your relationships. The one area that's really very different with youth DBT than adult DBT is that parents are included in the treatment. And one of the big areas they work on together is something they call walking the middle path. The youth and the parents learn to validate one another, learn how to compromise and negotiate, and how to see the other person's side of things. I wish I had that when my girls were teenagers. It would have been helpful. And in this, they really work on the dialectics, on validation and behavior change. Now, when there is a crisis, there is roles for coaches. And the youth coach helps or therapist, whatever you want to call them, helps assess for safety, make sure there's a safety plan, coach the use and the distress tolerance skills, validate their feelings and concerns, and try to decrease the emotionality in the situation. The parents also have a coach, because you need to get the parents in that wise mind rather than being either overly rational or overly emotional. To assess the safety, get the parents to make sure that they're following the safety plan, and redo the safety plan and strategies for future if that's needed. With the youth and parents, you do a lot of mindfulness exercises together. You try to get each group not to judge the other. You help them notice when they're in the emotional mind and help them get into the wise mind. Define behaviors in terms of effectiveness, like, is this really getting you what you want? Is it really that effective? Helping everybody stay in the present moment rather than talking about what happened 5 years ago in the family or even a month ago in the family. Help them understand that they need to observe in order to change. So one of the biggest takeaways I hope you take is that the DBT skill manuals for adolescents by Rathis and Miller is the thing that you want to get in order to do this treatment. Also, the behavioral tech, the Linehan Institute Training Company, I know they do a number of big trainings to get people to understand how to do this. I don't know if we have any Ohio trainers or not.
We do.
We do. Perhaps you can tell us who they are, Mr. Scheffler, Dr. Scheffler?
Well, I don't know that they're directly related to the DBT Research Institute, but you know, we have Denise Ben-Porath, who's at John Carroll, and she's one of our DBT experts. We also have somebody from Xavier, and I'm forgetting his name. I apologize for that. But we have a couple of folks that do train on this statewide, and they're excellent.
And this is the book. I don't know if anybody can see it, but this is the book that I would recommend if you're really interested getting it. It's really great. It has a lot of handouts that are youth friendly. It's all set out. It's very manualized, but it's really excellent.